everyone. Here's another episode of HuMed, Human Medicine. The idea of really talking about the human side of what we do every day as clinicians, as doctors. And I'm incredibly delighted to have Dr. Alexis Roach with us today, who is just finishing and maybe be considered a second year fellow, which is a trainee. She's in her fifth year of training after medical school in the field of pediatric emergency medicine, which is my field. And coincidentally, last night, Alexis and I worked together and saw some really crazy things. Maybe something will come up there. But I will turn it over to Dr. Roach, and she can give folks an overview of how she got here today.
I am originally from a suburb of Chicago, and I became interested in medicine early on in college. I went to Loyola University Chicago, and I then went to medical school at New York Institute of Technology, College of Osteopathic Medicine, and I've been at Arkansas Children's Hospital, so kind of all over. I've been there for my residency training and for my fellowship training, so that's where I met Dr. Spiro, and we have worked together since then, kind of during my residency training and also during my fellowship training.
Yeah, last night was crazy. We saw a number of things that were interesting. We had one child that came in unimmunized with a fever, a little 2-year-old, and that was interesting. And then we had another child that came in whose parents were fired, two of my colleagues, as they were not happy campers, and they almost fired me. And I don't know how successful I was in service recovery. And then we had Alexis and I ended the night with a teenager that came in with catatonia and potentially some psychiatric issues, which we deal with a lot. So we had a good night, a lot of amazing things. So real quickly, for those of you that don't know, fellows are still trainees. So Alexis is still working with me, and the way it works in our ER, which is very similar to other emergency departments around the country, is she will often take a report from a resident who sees the patient first. She could see the patient first and talk to me about it, or she may get report from a resident that sees the patient, and then they discuss the best plan of care, and I kind of listen in, and ultimately Alexis and I make the decisions about what to do. And over the course of 3 years, Alexis becomes more comfortable with making decisions on her own, especially in um, the crazy environment we work in, which can be challenging. Okay, thank you, Alexis. That's a great background. I know you're passionate about the work you do. I'd love for you to share a story about a patient or a moment in your career that has really impacted you and helped shape who you are as a physician.
So my story kind of starts in my favorite place, the emergency department. So I had met a hematology oncology patient who had leukemia, a little girl, and she was being admitted for the first time for a reason that we call febrile neutropenia. And in layman's terms, that means that a patient is undergoing chemotherapy and they have a fever and they're immunocompromised. So their body is really not able to fight off serious infections, so these patients often have to stay and be admitted into the hospital. My interaction with her at first was brief. I was able to meet her family. She's a very spunky little girl. But then later on, I didn't know this. This was kind of during my residency training. But while I was on my oncology rotation, I would kind of grow a stronger bond with her because she was really struggling with her treatment, and she was admitted into the hospital for my entire, oncology rotation month, and she was my primary patient the entire time. So I really got to build a strong bond with her. Unfortunately, her family lives far away. In our state, we're one of the only pediatric hospitals. We're the only hospital that has an ICU. We're the only hospital that has a level 1 emergency department. So patients who are more sick get admitted into our hospital, and sometimes their family is further away. And she came from a larger family with several siblings, and so her mom wasn't always able, and her dad wasn't always able to be at the bedside. So she spent a lot of her days when I was there by herself. Um, and so we were able to grow a really strong bond between myself and her, but also nursing staff and child life, the people that kind of play a really big role in these patients' lives. And unfortunately, this is the case for a lot of our patients. A lot of our patients are in the hospital, and there's quite a few that the families aren't able to stay with them the whole time, especially if they have a longer course in the hospital. And so there was a lot of times where I was able to play with her Peppa Pigs. That was one of her favorite things. She was obsessed with Peppa Pig, which for those of you who don't know is like a cartoon pig family. And there's one girl that's like the main pig, and her name is Peppa Pig. And so the times that I had free time, I'd try to play with her Peppa Pig, and she loved, reading several Peppa Pig books. She had several in her room, and we also had several in our workroom, which is where kind of we talk about patients and we write our notes, and we have, like, some computers and stuff in there. So when they have leukemia, many of them have something that's called a port. So instead of having an IV or having injections, they have medicine that goes through an area in their chest so that they get something through. And there's usually a little line that goes through that. And a a lot of kids will have to be woken up very early in the morning to get lab work, often every single day, sometimes multiple times a day. So they'll get blood drawn from that port, which some kids can find um, uncomfortable, frustrating, um, and especially when your mom and dad and your family aren't able to be at your bedside, you don't really have that comforting caregiver, and it's very, very difficult. Um, and so, ha- being able to have hopefully some consistency with the care team is sometimes very helpful for them. Also, it just kind of depends on the kind of cancer that these patients have. So, uh, this little girl had B-cell leukemia, but she had a lot of complications. She didn't respond well to her initial chemotherapy and had to later get immunotherapy. And all of these things have a lot of side effects. So, not just the nausea and vomiting that we think about a lot, but also a lot of discomfort and body pain. Um, and it can be really frustrating, especially when you're small and you don't really understand the medicines or what's kind of going on in the hospital to really kind of get an a thought of why is this happening, or why do I need this medicine? Um, so it can be very difficult.
You mentioned that her family wasn't always able to be at the bedside. Can you tell us more about the unique challenges these young oncology patients face when they're in the hospital for extended periods, especially when their family can't be there constantly?
So I got to know her very well. I mean, we would not only play with her Peppa Pig, but we'd read books, we'd do really fun things, and I got close to her family as she was admitted into the hospital. Um, they came every single point that they could and got updates on the phone every single day if they weren't able to be into the hospital that day. Um, and I think a lot of people in in the general public don't realize that even after we are done with a rotation, or even in the emergency department when I hand off a patient to the inpatient team or the ICU team, I frequently, and some people may do this and some people may not do this, but I frequently will look in their chart and check how they're doing, and oftentimes we'll go visit them in the hospital. So I'll go see them in the ICU. I'll go see them on the floor, especially if I had a strong connection with the family and with the patient, just to kind of see how they're doing. It's just because I care about them, and I want to just kind of have that close bond, so my relationship oftentimes hopefully doesn't end, kind of when I stop seeing them. I kind of am able to hopefully build a closer, tight-knit relationship, but even if not, I'm looking at their chart and seeing how they're doing because I'm concerned about them. And so for this particular little girl, it came a time where, as a resident, we rotate on different things. So once I was done with that month of oncology and she was still in the hospital, I still went and visited her, and she unfortunately did not do very well. But you could tell the difference that it made when she saw familiar faces. You could tell the difference it made when she saw, um, the nurses and doctors who were able to take care of her and have more of a longitudinal relationship with her, because the unfamiliarity of being moved from maybe one unit to a different unit is very, very difficult, especially when you know don't really understand because you're small. So this patient ultimately went from the oncology floor to something that we call the intermediate unit, which is kind of like an in between of the floor and the ICU. And she ultimately had to go to the ICU as well, the intensive care unit, because she just got really.
So this patient unfortunately took a turn for the worse. Can you describe what happened and how you navigated that emotionally as a resident who formed such a strong bond?
So she hadn't responded to her initial chemotherapy well, but the cancer was just still very active. So she was determined to be high risk and was started on an immunotherapy, which is kind of like a long word for saying that it's a medicine that kind of helps your immune system fight off that cancer. So she was started on immunotherapy and had a lot of side effects from that medication. um, she her body basically did not respond well to that medicine, and she got very, very sick from that, which is a possibility with the medicine that she was on. But she just her cancer really wasn't responding well to anything that they were trying, and I think that the side effects of the immunotherapy, um, really led her down the worst route where she had to be in the intensive care unit just to deal with the side effects of that medicine even once while it was stopped. And so it was all hands on deck trying to find a solution for her. Um, but there wasn't ultimately a solution that could really be found for her. Um, it's difficult when you have a patient for so long and you build a strong connection with them, and you just wish things could go differently. Like you wish that there was something you could do, um, but there's not always something we can do. We try our best, um, and we try our best to guide families through that, but it's just very difficult, emotionally for the medical staff, but also for the family to to go through all those difficult times. You try to think about the positive things that you experienced, but there are a lot of times that it's very difficult and emotionally uh emotionally draining, but also you know that you made a difference in that person's life, even if it was just for a short period of time.
Were you there when she passed away?
I wasn't there when she passed away. She passed away at nighttime, and I wasn't on at nighttime. I was there like the day before, um, and I wasn't on the IC. I wasn't on my intensive care rotation at that time, but um, all you can really do is kind of try to be there for the family, and she was surrounded by all of her loved ones. Um, Even people came from out of state and aunts and uncles, and so she was surrounded by all of the people who really loved her.
That's such a profound experience, Alexis. What was the greatest lesson or insight you gained from this difficult situation, and how has it influenced your practice today?
Mhm. I just felt, and sometimes I often feel this way when a patient unfortunately passes away because it just doesn't happen frequently in children. I just wish that there was more that I could have done. And I know that like that's not reasonable, and I feel like everyone can tell you, well, there's nothing more that you can do. Everything was done right. But at the end of the day, you're just like, well, I wish I could have done that more for them. I wish I could have. And that's kind of the first thing that goes in through your head, and then it kind of settles out, and you sometimes know people who cared for the same patient that you did, so in that circumstance, you can kind of, commemorate with that person, and there was one resident that I knew who actually was on a similar rotation after me, and so we cared for her, she cared for her as well, and so just being able to have someone to kind of talk about the positive things, um, and trying to refocus and kind of do more of a celebration of the happiness, and the joy that that person brought to the world, and is kind of how I dealt with that stress. It's hard in medicine because we we have these rules where we can't really talk about patients a lot. Of course, we can like say basics of stories or situations, but unless you know someone who really cared for that patient and knew them, then then it's just more difficult. It's more difficult to talk about and it's more difficult to cope with. But I hope that I hope that I I hope that I made her time where she was unfortunately in the hospital by herself a little bit more of a positive experience in a very negative situation.
That's a powerful takeaway. On a different note, because we as emergency medicine physicians deal with a lot of difficult situations and emotional experiences, how do you personally de stress and cope with the emotional toll of your work?
I learned really a couple of things. I learned about how important it is when you're taking care of a young child to try to speak to them on their terms, make the conversation something that they can understand, not just talk to their parents. I think a lot of us will kind of only talk to the parents and not talk to the little kid. And it's important. I mean, we need the story, so it's hard. We need to talk to the parents and the family that's in the room, but being able to kind of get to the child's level has always been kind of since that situation something that's been important to me, and I think that's reflected in my patient care. But then also when I have circumstances where I have a patient who's doing poorly and is going to pass away in the emergency department or pass away maybe shortly after in the ICU or somewhere else. I think it's important to have a clear line of communication of kind of what you are seeing, what you are doing in order to help the patient. So maybe you're giving them medicines, maybe you're doing something to help them breathe and going through to make sure that they understand all the measures that you're taking to help their child, but then also saying what you expect is the next step. If you expect that this may not work, and the if this does not work, then your child may pass away, and or your child may need these extraordinary measures beyond what I'm doing right now, and just making sure that the communication is there is important. It's hard when you're in the room and there's a very sick kid in front of you because you're trying to not only kind of tell the team what you're doing and tell the team, oh, we need to get this medicine, we need to do this next. But then also you have the parent that's right behind you or the family member that's right behind you or near you in the room that you want to also make sure that they understand and kind of see what you're doing and understand what you're doing, that that you're trying everything that you possibly can to make sure that their loved one is taken care of. I'm lucky that I have a great relationship with my family, and so I sometimes my family, we talk about like other things outside of medicine is important to me. But then one of my favorite things to do is I love to take my dog to the park and go on a long walk. Like, I just need to do something outside to de-stress. I love nature, so and, I know that that's something that my dog was I enjoy. And so just being able to get outside and just go for a walk, no matter how long we're doing it, like, if it's a 30 minutes or if I only have 10 minutes or something short, just being able to go outside and kind of reconnect with nature and breathing fresh air is important to me. I also like to I've had a really rough day, and I like to go to the gym or work out and kind of do things that way. Um, and so it just kind of depends. But probably my favorite thing is just spend time with my family, with my husband, and go for a longer walk with our dog and kind of just talk while we're walking and see nature.
What message would you share with future healthcare providers or even just anyone interacting with someone going through a difficult time based on your experience?
I would tell people to in any situation, not even in just in healthcare, if you're taking care of a patient, but if you're dealing with loved one that's sick or a family member, a friend, neighbor, try to be as empathetic as you can. Try to understand kind of where they're coming from. Not not everybody can be at their loved one's side when they're sick every day. There are life circumstances, and sometimes you have to make the best of every situation. So try to understand where that person is coming from. Try to put yourself in their shoes, and try to have an idea of if you were that person, how you would want to be treated. And that's really what I try to do. I try to imagine that I'm that person. I try to imagine I'm that person's loved one and how they would like to be talked to and treated every day with love and respect. It's just nice to sometimes feel that love that they have for you. It's just having your animal be excited when you get home and stuff like that. I think is what brings people a lot of joy.
Alexis, thank you so much for joining us today and sharing your story. You're an incredible human being and an incredible fellow to work with. And I'm just incredibly honored that you joined us today. And I just want to wrap this up. So thank you all for joining today. Please follow us on Spotify, Apple Podcasts, YouTube, or wherever you get your podcast information. And I hope you all have a great day. Thanks. Bye.